Yes.
So I always like to start at the feet. So if she's fussy at all, make sure that her whole body's straight. So I'm going to move her head. So she's like, I heard you. She's such a model. She moved her head for me. If she's got any gas or toots or poops in there, now we just changed her, so she doesn't. But if she's poopy, gassy, you can put your thumbs on her feet or behind her legs and just kind of lift up, do a little gentle rock. This will get her in a squatty potty position where she can push off to help relieve gas or to help push out poop. Now she's like, I don't want to do that. So I'm like, okay. And then she does. Model student. She is just a model student. So you can do a little gentle rocking. You can always do those bicycles this way. Do we get it all out? Now another stretch that I love to do is called the guppy pose. So when you have a long lap like me, we can take her up to the end and let her head just kind of rest on the back of your legs. Let her stretch that out. Okay, so we're opening up her chest. Now she's like, I don't want to do that. So you can also do it in your hands. So you can take the palm of your hand on her back and then hold her head this way. And let her just kind of rotate side to side. So see how it's opening up her chest?
Yes.
It's releasing any tension in her back and in those shoulders. Now, if you want to do it on your lap, so this is a guppy pose. On my legs was a modified guppy pose. If you have short legs, like most people do, I'm 6'1", so I'm taller than most. You can also do it this way. So you can lay her back across your legs, and then her head is just on your lap that way.
Okay.
So you're holding her body. Her butt's on your other leg. And you're just kind of letting her dangle and open. Now, she is telling us, right, she doesn't really like this pose.
Yeah.
Most babies will, like, relax into it. But she's getting a little antsy. So she's telling us she doesn't want to be in this position. So we're going to take her out of it. No, come on up. Hi. So then we'll come back up. I know, into her mouth. So we're going to do just some cheeky cheeks first. So we're going to go 1, 2, 3 squishy lips. And then 1, 2, 3 circles. Her cheeks look great. I'm not seeing a lot of tension there, so don't feel like you have to do that very often. She's got really nice cheek movement. Now to go actually work on her tongue, I'm going to ask her to come in and look how nice and wide she is. So first I'm going to rub on her gums. So I'm just going to go back and forth where her teeth are going to go. 1, 2, 3. Then I'm going to take my finger and turn it over, and I'm going to have her chew on my finger. So I'm going to push up where that back molar is going to go. Do you see how she bit down, but now she's kind of chewing? We want to see her just chew on that finger. It's a reflex that we're triggering. There she goes. You see how she's doing a nice rhythmical chew, like she's chewing bubble gum? That's what we want to see. Good job. And then we're going to go to this side and see.
And that's the back molars.
Back molars, where that upper teeth are going to go. There she goes. She looks really nice with that. Do you see how she's like rhythmically chewing?
Yeah.
Then we're going to come on that tongue. So I'm going to touch the tip of her tongue and then come out. And I want to see that tongue like bullfrog out. So I'm going to say, hey, touch the tip and then come out. She's like, oh. There it goes. Did you see
that bullfrog the out? Kick. Yeah.
So that's to help her when she's at the breast to get that tongue down and out around that nipple.
Yeah, that would explain, because when she clamps down, it's the under part that was hurting.
Yeah.
Because she wasn't.
So she has a tie under there, so she is restricted in being able to stick it out and keep it out. Because she's feeling that tension from that band under the tongue. But this will help her practice that for when it is released, that she'll all of a sudden be like, oh, I can actually stick it out further. And the last one, so that was out. We want it also to move side to side. So I'm going to touch the side of her tongue and then come between her gum and her... Do you see how nicely she moves it? So touch the side of her tongue and then between the gum and lip 3 times. 2,
do that for me one more time.
3. So we're going to do, switch hands and I'll show you on this side.
Yeah.
So I'm going to use my thumb and help with her jaw. Now she's getting to the end of a rope because she's tired.
Yeah.
But I'm going to touch the tongue and then come between there. So touch this side and come between the lip.
Got it. Okay.
And then one more time. So she's got really pretty nice lateralization. But you can see when she sticks that tongue out, there's just a little bit of a divot in the tip.
Yeah. I see
and
that.
And she's got that lip blister right here because she's using those lips to compensate for her tongue.
I see that.
I know you just want to suck. There we go. And if at any point in time she starts fussing for you, you can always give her your finger to suck on. Now you can do a little tug of war. She's got a nice strong suck. So as I'm kind of pulling out, she's pulling my finger back in. Her strength is great. Her coordination is great. Her tongue is just anchored because of that frenulum underneath.
Okay.
And that's it. It's literally just that quick.
Oh, wow. And are those similar to the exercises that I would do after the...
Exactly.
Okay.
Yep. Now when she's sleeping, nice job, nice strong suck. Now did you see how her lips went white? Mm-hmm. She's using those lips to grab around to compensate for that tongue. So she's very smart in how she's compensating. Now when she's sleeping, you can always come in and close her mouth. Okay.
Okay.
But that's it. Those are all our exercises.
Yay! You did so well.
She really did. She did great.